But first, we begin with the latest on the coronavirus emergency. The CDC now predicting deaths could hit as many as 145,000 by July 11th, while 9 states will likely have more deaths in the next 4 weeks than the previous 4.
20 states right now are seeing an increase in cases, including Oklahoma, which reported a record daily high for new cases. And that is where President Trump will be tomorrow night, holding that rally, which was originally scheduled for today, Juneteenth. Marcus Moore is in Tulsa with the latest on all of that. Good morning, Marcus.
Well, Amy, good morning. This is what it looks like right now here in downtown Tulsa, where you can see a number of Trump supporters. Some of them have been camping out here for days ahead of Saturday's planned rally that's expected to draw tens of thousands of people to the BOK Center. This morning, all eyes on Oklahoma, where crowds have been lining up for days to see President Trump hold his first campaign rally since the pandemic began.
It's a crowd like I guess nobody's seen before. We have tremendous requests for tickets like I think probably has never happened politically before.
100,000 people expected to descend on Tulsa as COVID cases and hospitalizations climb in the state. But the president is unfazed by the fact, wrongly claiming
the numbers are very minuscule compared to what it was. It's dying out. Oklahoma has had a very low rate, relatively speaking. It is a little spike.
And while the Trump campaign plans to do temperature checks, provide hand sanitizer and masks, but not require them, the Bank of Oklahoma Center is now asking for a written plan to practice social distancing, something the Trump campaign has not addressed. Oklahoma is one of 20 states seeing an increase, along with California, where Governor Gavin Newsom is now requiring residents statewide to wear masks.
Hospitalization numbers are just starting to creep back up, and I'm very concerned by what we're seeing.
Florida reporting a new daily record, more than 3,200 new cases Thursday, the state's highest single-day total since the pandemic began. Now, New York's Governor Andrew Cuomo announcing they'll consider a mandatory 14-day quarantine for travelers from the Sunshine State, just like Florida did for New Yorkers when the outbreak started.
Now we're afraid they're bringing the virus to our state.
In Montgomery, Alabama, where cases are climbing, the ICU filling with new patients.
We're never going to have to worry about a second wave because we haven't gotten out of the first wave.
In Texas, over 100,000 cases across the state. But those battling the virus sharing a new warning. Michelle Hart from Colorado tested positive in April and spent a week in the hospital. Now, despite having 2 negative tests since, she tested positive again this week. She says her blood test showed no antibodies.
I think the scary thing about it, other than the physical symptoms, of course, is just not having any answers.
I've talked to a number of Trump supporters here this week. One man told me he does not intend to wear a mask during the rally, but another woman said that she would out of respect for others. But the one thing we've heard from everyone is that they are not at all concerned about the spread of COVID-19 during this weekend's rally. Amy.
All right, Marcus, thank you so much for that. We're going to be joined now by Dr. Jennifer Ashton for the very latest. And Dr. Jen, let's start with that woman from Marcus's story. We just heard she tested positive in April. Then she had 2 negative tests and then tested positive again and is sick again. Is there a medical explanation for this?
Well, there is some data on it, Amy. It comes out of South Korea, released by the CDC. They looked at 285 patients who had the same thing, positive, negative, then positive again, in some cases up to 82 days out, and found not a single one of them had what we call live virus. So the evidence right now points to the fact this is called viral debris, parts of the virus that the person is not reinfected and not infectious or contagious.
And we just reported on President Trump's rally that's being held in Tulsa. It will be held indoors. Some 20,000 people expected to pack that arena. What kinds of precautions need to be in place to ensure safety? We heard Marcus say that the people he talked to said they weren't concerned about getting COVID-19.
Well, the CDC released some recommendations on how to assess risk. There's no such thing as zero risk, but they consider gatherings where there are a lot of people that can't be more than 6 feet apart, especially when they're coming in from outside the local area, to be the highest risk for spread of COVID-19.
All right, so there should be some current concern and some precautions being taken place. All right, thank you so much, Dr. Jen Ashton.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.